How do you choose the right hearing health care professional? This is a really good question, and I appreciate you asking it. There's a few things you want to keep in mind. If you have a hearing loss, and let's say it is sensory neural, and it does require hearing aids, now you're looking at long-term care, right? So if your hearing loss is due to an ear infection, that's going to take some antibiotics. You might see the audiologist twice, and then you're done. But when it's sensory neural hearing loss and you're needing hearing aids, it's lots of appointments. And so a couple things you want to make sure is, one, you're working with a facility that's convenient to get to. It's a not one and done, right? You're going to have your evaluation, you're going to have your fitting, you're going to have your follow-ups, and that's follow-ups for the life of the hearing aid. It's not just 1 or 2 visits. Remember, better hearing is not like better vision. When we have a vision loss, we put on glasses and we see clear right away. It doesn't work that way with hearing. It's a rehabilitative process. It takes time for our brain to re-recognize sounds and make sense of speech. And so there's lots of follow-up visits. Typically, you're going to see your hearing health care provider about 3 to 5 times in the initial 75 days as adjustments are made to the hearing aids and adjustments are made to your brain's ability to listen and understand speech. So again, you want to make sure they're convenient to get to. But second most important is that you want to make sure they're following best practices. Unfortunately, there are many hearing healthcare providers out there that, one, don't work with all manufacturers. They only sell one brand or one manufacturer. That does not give you a whole lot of choice. Not every manufacturer makes a hearing aid that's appropriate for everyone. So you want to make sure you're going to an office that offers lots of different manufacturers. In addition, there are some practices out there not following best practice in that they put the hearing aids on you and they ask you, how does it sound? Okay, great. Call me when you need me. That's not best practices. There are many different tests and assessments that need to be done in order to ensure you are hearing at your best. So when you come in for the initial evaluation, they should be doing questionnaires, asking about your lifestyle, your listening experiences, what types of environments you're having difficulties in. And in addition to your basic or baseline hearing tests, they should be testing your ability to understand speech in noise. It's the #1 complaint of people with a hearing loss. So they should be assessing that, right? Then once you get your hearing aids, they should be doing real ear measurements, test box verification, functional hearing tests with your hearing aids on. And again, they should be following a proven treatment process throughout the life of the hearing aids. So for example, at our office, we offer a 75-day adjustment period. So you can return your devices within the 75 days. In those first 75 days, we're going to see you about 3 to 5 times. We're going to do the real ear measurements, the test box measurements, the functional hearing test with your hearing aids on. And then we're going to see you every 4 months for the life of the hearing aid. We're going to do preventative maintenance on the devices as well as annual hearing evaluations. As there's changes in your hearing, we want to account for that in the programming of the hearing aids. You can visit hearingup.com or hearingloss.com to learn more about best practices and how to find a qualified audiologist in your area. All right, friends, I'm Dr. Maria Morrison, audiologist. I'm your expert in hearing healthcare. I'll see you next time. Bye-bye.